Thank you so much, Dr. Agarwal. I appreciate that very kind introduction, and I look forward to spending the next 30 minutes or so talking about online scholarly publications for clinician educators, ideas, and a lesson learned. I'm going to share my screen. As far as disclosures go, I don't have any financial disclosures. I do serve as the education editor for the journal Pediatric Anesthesia, and as Dr. Agarwal mentioned, I'm the editor-in-chief of Open Anesthesia. I do receive a small stipend for these roles, and I will be discussing publications from both these places. In addition to this, I also serve as an editor for the SPA case guides and question of the week and one pages, and I'll be discussing that as well. So I'm going to take a step back and talk about scholarship, and this is something that something all of us in academic medicine are very interested in. And when you look at scholarship broadly, it implies some form of creativity. And the central purpose of any kind of scholarship is to advance our specialty and disseminate knowledge. Now, when you look at scholarship broadly, there are two major components. The first one is there has to be some kind of a creative, interpretive, or innovative work. That's the first piece. And the second piece is how these resources, whatever you create, is shared, it's understood, it's evaluated, or peer reviewed or critiqued by the people. So both these processes have to work together for having some kind of a good scholarly product. Now, in the early 1990s, Ernest Boyer described four different types of scholarship. There's the scholarship of discovery, there's a scholarship of application, scholarship of teaching, and scholarship of integration. And the only times we typically encounter this is when we are filling out our promotion dossiers, and all our School of Medicines have these different categories for, like, does this count as scholarship of discovery or teaching or whatever. So that's kind of the only time that we actually encounter these. What I'm hoping to do is in the next couple of minutes, just give you a very broad overview of the different types of scholarship, and then I'll share specific examples of different types of online scholarly publications that I've been involved in over the last few years. So the first one is the scholarship of discovery. This is the classic, the more traditional PubMed ID publication. That's, hypothesis-driven research. That's either, it could be a basic science paper, a clinical research paper, or even translational research. That usually, as I mentioned before, these are the more classic PubMed ID publications, and even educational research that gets published in peer-reviewed journals counts as scholarship of discovery. This is what that all of us have, and what traditionally promotion committees look at is like how many PubMed ID papers, what's the H-index, etc. Now, in addition to all of that, there's also the scholarship of application, where the goal is basically building bridges between theory and practice, or to apply clinical knowledge to very practical issues. And this takes usually the form of clinical pathways that you develop at your own institution, white papers that you write for professional societies that you're involved in, and even public health policy, etc. A lot of the QI work that a lot of us are interested in often comes under this scholarship of application. The next category is scholarship of teaching, which I'm going to be focusing on over the next 30 minutes or so. And these are typically takes the form of scholarly products that leave the classroom. So in addition to all the didactics that we do in the operating room or in the traditional classrooms, this includes things such as the syllabi, the curricula that we put together, the simulation papers that we write, or even the videos, the podcasts, and etc. that are created from these educational activities. So this is the scholarship of teaching, and I'm going to be focusing on that. And finally, there's the scholarship of integration, which usually takes the form of review articles, educational reviews, book chapters, case reports, and even a lot of the publications in the medical humanities come under the category of scholarship of integration. So, as I mentioned earlier, there are four different types of scholarship. I'm going to be focusing on scholarship of teaching and focusing specifically on online scholarly publications. So, over the next 30 minutes or so, I'm going to be talking about 5 different scholarly products. The first one is the Air Trap series of articles that are published in the journal Pediatric Anesthesia. The next 3 are products from the SPA that are published on the SPA, the Society for Pediatric Anesthesia website. And finally, spend some time giving you a tour of what open anesthesia is and what kind of products that we have on open anesthesia. So the first one is the Air Trap series of articles. And so back in 2019, I came across this journal, Seminars in Pediatric Surgery, and one of the particular issues of that journal in 2019 was titled Error Traps and Culture of Safety. And so what they essentially did here was they selected several complex pediatric surgical procedures, and then they came up with these papers. Then they called it Error Traps papers, and where they essentially, the focus was to highlight common mistakes or iatrogenic errors that occurred while performing these surgeries. And essentially they talked about lessons learned, how to avoid these mistakes, and you can think of them as clinical pearls, so to speak, that often gets passed down from senior professors or clinicians onto trainees. And so I really was enamored by this paper, like the series of like articles, and I was like, why not we have something like this in pediatric anesthesia? So I partnered with a colleague of mine, Dr. Whitney. We made a proposal to the editor-in-chief of Pediatric Anesthesia, Dr. Andrew Davidson, and came up with these series of articles known as Air Traps and Culture of Safety in Pediatric Anesthesiology, where, again, as I mentioned earlier, the focus is to highlight error traps, which are circumstances, it could be single or it could be multiple, that lead to erroneous actions or undesirable consequences. Again, bad things can happen. How do we keep an eye out for these bad things so that we can improve patient safety in pediatric anesthesiology? So this project started about four years or so, and over the last 4 years we've published more than 20 papers on all the different topics in pediatric anesthesiology. And what I've done here is just shown you some examples of the papers that have been written and in these series. So we've had error traps in pediatric difficult airway management, and in the next slide I'm just going to give you some snippets of the topics discussed in that particular paper. We've had error traps in anesthesia for fetal interventions, error traps in pediatric regional anesthesia, and these are all basically some examples of papers where, again, as I mentioned earlier, the goal is to highlight iatrogenic errors and how to keep an eye out. For the first one that I want to highlight is the error traps in pediatric airway management, where the authors broke down the different types of errors into 3 types. One is preparation errors, performance errors, and proficiency errors. And one thing we try to focus on in these papers is to highlight the different cognitive biases that occur. So these are so common, such as anchoring bias, authority bias, overconfidence, etc. And so we try to show how these cognitive biases are so common in our clinical practice, and then things that we can do to prevent this or mitigate these or minimize the effects of these different biases that we have. So this is an example of what the paper on error traps in pediatric airway management talks about. So focuses on all the different types of cognitive biases and errors that can occur. The paper on error traps in anesthesia for fetal interventions, this one talks about all the major categories of bad things that can happen during fetal interventions. So not preserving uteroplacental circulation, not maintaining complete uterine relaxation, not monitoring the fetus, not being prepared for postpartum hemorrhage, or failure to recognize and treat this promptly. So as you can see, there's definitely a very practical clinical focus on these papers, and so they have been actually very popular in the journal, and often these papers show up as one of the most highly downloaded papers in the journal. So it's definitely widely disseminated and read. Other examples of papers in the error trap series, we have error traps in acute pain management in children, and Dr. Agarwal has been an author in both the acute and the chronic pain management paper for children. We have had air trap papers on pediatric liver transplantation. This is the one that talks about acute pain management. I won't spend a lot of time on it, but not recognizing it, pain adequately, not assessing it, not using the right analgesics, and not, again, basically clinical practical tips on what to, what to avoid while taking care of children in pain. Other examples of air traps papers are air traps in pediatric one lung ventilation or patient blood management. Taking care of children with type 1 diabetes is often fraught with a lot of errors, and as far as dosing of insulin and how to manage hypo or hypoglycemia. And so this also is a very frequently read paper. Tony Sawyer from Stanford is also an author in one of the papers on anesthesia for neonatal surgical emergencies. We have air traps on intra-hospital transport of critically ill children. Again, while transporting children, a lot of bad things can happen, both inside the hospital and even pre-hospital transport. So this paper focuses on that. And infant spinal is also something that we don't do very frequently, and so this is also a pretty popular paper, so to speak. We have along the lines of all the different topics of pediatric anesthesia. We have papers on what to avoid while setting up an ERAS program. Dr. Navaratnam was an author on the paper on patients with congenital heart disease having non-cardiac surgery, and they're actually writing another paper on patients with congenital heart disease having like actual cardiac surgical procedures. So that's in the works. Again, as what I want to highlight is basically different types of pediatric anesthesia topics, and we try to focus on all the different errors that can occur. These are the most recent papers in this series, air traps in global anesthesia, where we focused on like what are the things to avoid while you go on these global anesthesia like so-called mission trips, which this term is not being used anymore, but things to avoid, and this is also a very popular paper, so to speak, and the most recent one is on pediatric TIVA. As I mentioned earlier, we have quite a few more that are in the works. So anesthesia for pediatric burns, there's one on trauma that's being written right now, tonsillectomy, and as I mentioned earlier, the air traps in pediatric cardiac anesthesia is being written. So now, which leads to what I want to ask this audience is that, can you think of other topics that will be ideal for one of these air traps papers? And this is not something that has to be specific for pediatric anesthesia. So what if the OB anesthesia team or the cardiac team at Stanford put together a series of articles. So you go to your subspecialty journal, make a proposal that you're interested in putting together these air traps papers, and I can bet you that they'll be very popular and widely disseminated. So this is just an idea for another subspecialty to do this. To the best of my knowledge, I do not know if other specialties have something similar. So I just wanted to share this as an idea for that can be duplicated for other specialties. I know obstetric anesthesia has a series known as This Is How I Do It, and I know ASRAD also does something similar, but I do not know if there's anything specific that looks at air traps. So just an idea for other subspecialties who could do something similar. The second online scholarly product I want to talk about is the SBA Question of the Week project. So this is something that started during the COVID pandemic. The ORs were shut down. We were not doing elective cases at that time, and we wanted to find a way to keep our fellows engaged in self-directed learning. So we identified a bunch of topics from the pediatric anesthesia keywords that the ABA releases every year. And then we chose topics based on the most commonly missed items at during these in-training exams or the peds anesthesia boards. We came up with a list of topics, and we asked our fellows to write a multiple choice question on a topic, on a keyword, so to speak, and then write a 2-page summary of the topic. based on the multiple choice question with references and also an explanation of why the answers are correct and why the other distractors are wrong. So we started this as a local educational project at Children's Hospital Colorado back in 2000. And what we found, we paired these fellows up with a faculty mentor, so there was like a little bit of a mentorship and learning there as well. And so these actually got pretty popular within our institution, and then we subsequently reached out to other programs to see if they would be interested. And so there was definitely a buy-in from a few other programs we reached out to, and we subsequently reached out to the leadership at the SPA to see if these could be officially called the SPA Question of the Week project. And so since 2000 or 2021 or so, we've started publishing these SPA Question of the Week on the SPA website. So if you go to the SPA website like this, right at the home page, there'll be a multiple choice question that this typically is, on a keyword. In this particular case, the keyword is neonatal sepsis. But what you can see is the clinical scenario and the question. And when you can click the answer, it'll tell you if it's right or not. And what comes up is this 2-page document that talks about the keyword. It talks about the multiple choice question, a little bit of a background, what are some salient points, references, and also an explanation of why something is correct and why the other distractors are wrong. So as I mentioned earlier, we started this in 2021, and over the last 4 years or so, we've published over 200 questions on the SPA website. These are, and as far as like the statistics go, these questions are included in the email, the weekly email that goes out to all the SPA members every Friday. And based on that, we know that about 600 to 700 members answer these questions every week. Our team includes about 8 editors right now, and there's a very robust peer review process where once we receive a submission from an SPA member, they're assigned to 3 editors in our team, and then we provide feedback. And most of the questions that we get go through about 3 or 4 revisions before they're finally published on the SPA website. And this, we've had submissions from over 30 institutions. And as I mentioned earlier, since 2021, we have over 200 multiple choice questions that are on the SPA website and that can be accessed by SPA members. Now, this does count as online, like, a peer-reviewed publication as a scholarly project for our fellows. And we also encourage our residents who are interested in pediatric anesthesia to submit questions. So the way to do that is to reach out to the SPA Question of the Week at gmail.com. And then you'll be assigned a topic. You pick a faculty mentor. You get 6 weeks to write the question. As I mentioned earlier, your submission is peer reviewed by 3 editors, and then they finally get posted on the SPA website. I also want to point out that this, if you're looking for good, high quality pediatric anesthesia multiple choice questions on general topics, this is a fantastic resource. And this is for fellows reading for the PEDS boards, and also if residents are interested in looking at PEDS topics, multiple choice questions, this is definitely something worth looking into. I also want to point out that the SPA membership is either free or is heavily discounted for medical students and residents, so please consider joining the SPA to access these resources. These are, as I mentioned earlier, on the SPA website, and you get the current question of the week on the homepage, and the previous week's questions are listed on the education tab of the SPA website. The next scholarly product I want to talk about is the SPA case guide. So this is the brainchild of Dr. Joseph Sisk, who is a pediatric anesthesiologist at the University of North Carolina, and I serve as one of the editors. And these are meant to be cognitive aids designed to help anesthesia providers prepare for complex cases. So if you, for example, if I'm assigned to take care of a kiddo with a vein of Galen malformation who's getting an embolization, this is not a case that I've done in the last 2 years, and I want to quickly look up what's involved in caring for this patient. And so I could go to the SBA website and look up these SBA case guides. These also are formatted similar to the SBA question of the week, but these are slightly longer. They're more than 2 pages. They often run into about 4 or 5 pages, but they all are set up this. They have a similar like format. There's the background, anesthetic planning, how to set up for the case, what to look for specifically in the pre-op, intra-op, and post-op care, and case-specific complications. And again, as I mentioned, these are also like in the similar format. They're published on the SBA website, and we have more than 100 of these SBA case guides. If you think about complex pediatric anesthesia case, you can probably find it under these SBA case guides, and covering all the different subspecialties in pediatric anesthesia, from cardiac, general surgery, neuro, ENT, all the different types of transplants, urology, all different types of peds regional blocks, etc. So this is also a fantastic resource for trainees and for faculty who are, who haven't done a case. Like, for example, I've not done a diaphragmatic hernia in a year. I can quickly look up the SBA case guide on diaphragmatic hernia to kind of refresh my memory, so to speak, before I embark on taking care of the child. So these also are available for all SBA members. And this, I look at this as like a Jaffe's manual, so to speak, but specifically for pediatric anesthesia. And again, this is another idea. I do not know, honestly, if other subspecialties have this, but this has been a very popular resource for our trainees, and we get a lot of good feedback. So, Dr. Sisk, I'll be happy to connect you with Dr. Sisk if you have any questions about how he went about, selecting topics for this, and how he, this I think is a fantastic product that the SBA has put together. And then the next one I want to talk about are the SBA one-pages. So these, as the name suggests, are one-page summaries of a topic, and there are different like medical education topics, there's faculty development topics, and wellness and sustainability. These are the 4 categories of topics that are highlighted under the one pages. And as the name suggests, they are whatever fits on one page is what goes on these things. And I don't think you're going to be able to read this, but these are the different medical education topics. And some of the ones that I often go back to and look at all the time is how to write learning objectives, how to find copyright-free images for your next PowerPoint presentation. The ones on how to be a good mentor and mentee, I think they are on the subsequent slide. Those have been written by folks at Stanford. How to write a good multiple choice question, how to use the flipped classroom, how to give a good presentation, etc. All these we have one page. This is the one on how to find copyright-free images for your next presentation. This I wrote this with one of our librarians at the University of Colorado. It talks about all the different types of Creative Commons licenses. It talks about resources where you can go and find copyright-free images for your next presentation, and how to do a Google search and find the images that have a Creative Commons license, so to speak. So as you can see, this all fit on one piece of paper, and that's why we call them an SBA one-pager. We also have several faculty development topics, so things like how to be a good mentor, how to be a good mentee, how to negotiate with your boss, how to have a difficult conversation with your boss or patients, how to break bad news. These are all like very succinct, to the point. They're very concise. Please check them out. This is on how to write a letter of recommendation. Of course, now most of us are using ChatGPT to do this, but before that, we did put together this quick one-page guide on how do you structure a letter. You've not written a letter for a long time, or for somebody who is either going up for promotion or who is applying for residency. So how you break down your letter, how do you write that letter so that it doesn't look like it is something that's generated by ChatGPT. So check out this one pager. These are available for free on the SBA website under the education tab. You can click, and I'll be happy to share my screen and show you where these things are. In addition, we have a fantastic list of wellness one pages as well, and a lot of these have been written for by members of the SPA Wellbeing Committee on how to set up a peer support network or resilience or good building good habits. These are fantastic resources, I think, to check out. These are all available for free on the SPA website. This is an example of one on how to set up a peer support program and how to be a good peer supporter. Again, I learned so much just looking at these things, and I encourage you to also check them out. So finally, I want to talk about open anesthesia. I'm going to spend a few minutes. I think the best way to do this will be to actually take you a tour on our website so that I can show you all the different parts of open anesthesia. And before I get there, I just want to mention that Open Anesthesia is an online educational resource that's sponsored by the International Anesthesia Research Society. So it was formed in 2012 to 2013 by Dr. Ed Niemergut, who was at that time at the University of Virginia. I've been involved with Open Anesthesia from about 2016 or 2015 or 2016, and I became the editor-in-chief in 2022. So Open Anesthesia, you have to register. It's free. It's open access. But you still have to register. And we did that to get an idea of who our users are. And currently, we have more than 70,000 subscribers worldwide. About 65% of our users are in the United States and Canada, and it's used by anesthesia trainees and clinicians from all over the world. As I mentioned earlier, about more than 70,000 subscribers worldwide, and our website gets about 80,000 unique visitors monthly. So whatever goes on Open Anesthesia definitely is getting widely disseminated, because I do not know that many people. So it's definitely being used by lots of people. And what I would love to do is share what the website looks like, what resources we have, and opportunities for contributing to Open Anesthesia. So I'm going to stop my share. Oops, sorry, not wrong one. Are you able to see my screen? Yeah, perfect. So yes. This is the Open Anesthesia website. So this is the homepage where we have whatever is new, what is highlighted on this panel on the top here. We have a question of the day that also gets published on the Open Anesthesia website. There's a job posting by the IRS as well. So what you can see here is we have different types of content on Open Anesthesia. The ones that I want to focus on, before I get to the different types of educational content, I want to talk a little bit about the Open Anesthesia team. And I want to give a shout out to a couple of folks from Stanford who are part of the Open Anesthesia team. So as I mentioned, this is something that's sponsored by the IARS, and we have different types of content. So we have some folks from Stanford who are a part of the editorial board. So Dr. Carol Lynn is our our media editor for Open Anesthesia, and then we have Dr. Natalie Coons, who is one of the residents at Stanford, who serves as our resident liaison to the ASA resident committee. I know she's listed. Oh, that's Dr. Natalie Coons. And Dr. Albert Tsai is also one of our cardiac anesthesia associate editors. So we have good representation from Stanford in this editorial board. We have a team that with representation from all the different subspecialties in anesthesia. And this is definitely a team effort. The amount of work that goes into maintaining the content on this website is incredible. So I want to start by talking about summaries. Summaries are 5 to 7 page mini reviews of high yield topics. And the way we have it set up is we have all these filters on the left side. For example, you click on, you want to look up a summary on an OB anesthesia topic. So it'll list out all the different summaries on OB anesthesia topic, and let's just pick one. For example, let's just do renal physiology and pathology. The way these are set up is they look similar. So these are 5 to 7 page mini reviews of high yield topics. We like to use tables and figures as much as possible. And then we have references at the end with PubMed links to it, and the authors get credit for this as well. So this is a quick read. And then what I want to also mention is that we have more than close to 600 of these summaries covering all the different subspecialties in anesthesia. And so and they are broken down into advanced topics and basic topics. And then you can also go in and say that I want to look at just stuff on hepatology. And so as you can see, they're like, if you are a transplant fellow, this is like a goldmine of information for all the topics related to like transplant anesthesia. That, let's look up what is post-perfusion syndrome. I have no idea what that is, but let's look it up. So key points, introduction, risk factors, management, some figure, and then some references at the end. So these are particularly high yield, and the topics for these are based on the ABA keywords and then the content outline from the ABA. So this is a very rich resource. We have multiple submissions from folks who are interested in submitting scholarly products. They all get peer reviewed. So once you submit something to Open Anesthesia, it gets looked at by the associate editors or the section editors, and then I'm often the annoying reviewer number 2 that looks up at these things before they get published on the website. So that's the first type of content. These are summaries. These are 5 to 7 page mini reviews of high yield topics, and they're broken down into different subspecialties. We also have a team that looks specifically as translating these summaries into Spanish. This is just we just started this project, but essentially the same thing. For example, myelomeningocele written in Spanish by again often translating the content that we already have on this website, because we have a huge interest in expanding and providing access to folks in Latin America, and so there's a lot of interest in creating content in Spanish as well. So that's the first type. These are summaries. The next type of resource I want to highlight is the podcast. We have close to 90 podcasts on all the different subspecialties. For example, you can see here the podcast on cardiac anesthesia. It looks like Albert's recorded a few podcasts. These are often short interviews with experts in the field, and you can again filter them down by subspecialty. You want to listen to all the podcasts in pediatric anesthesia. You can click on the filter, and as you can see here, we have tons of different podcasts on clinically relevant topics, so to speak. The next one is type of content are the videos or the wadcasts, and I want to highlight a few different types of curricula here. The first one I want to talk about is the POCUS Case of the Month. So these are developed by our POCUS team. So these are short, they're often less than 15-minute videos on, again, clinically relevant topics. For example, the first few of these looks like they talk about lung ultrasound. We have a bunch of videos on gastric ultrasound. And then when you look at the other pages, you can see that we also have stuff on RV function, LV function, aortic stenosis, you name it. These are short POCUS videos. These are also super high yield, and I encourage you to check it out. The Society for Obstetric Anesthesia and Perinatology does a webinar every month for all the OB anesthesia fellows around the country. And these are longer presentations. They tend to be about 30 to 45 minutes, and we have more than 100 videos on all different OB anesthesia topics that's co-hosted with SOAP. These also are published on the Open Anesthesia website. Another example is a PAINS curriculum that was the joint collaboration between the Society for Pediatric Anesthesia, the Pediatric Anesthesia Program Directors Association, and the SPA. And the goal here is to create short videos on non-technical skills. So PAINS stand for Pediatric Anesthesia Internet-based non-technical skills. So things like medical education or faculty development or basics of clinical research or QI methodology and patient safety. So they're short videos. These are usually about 15 minutes long, and these also are super high yield. The SPPM, the Society for Pediatric Pain Medicine, makes these short videos on clinical. They call it clinical PERTs. Usually they are less than 5 minutes, usually a couple of minutes or so. These also are posted on the Open Anesthesia website. The sustainability series, I think Carol has done a bunch of videos on sustainability. They're also posted on the Open Anesthesia website. So as you can see, we have summaries, which are like 5 to 7 page mini reviews of high yield topics. We have a bunch of podcasts, and we have a host of videos on open anesthesia as well. And finally, I want to talk a little bit about the external resource section, which is where we include content from our collaborators. So for example, there's an APSF podcast that's posted on the Open Anesthesia website every single week, where they highlight articles from their APSF newsletter. Another resource is the baby blocks, where we include pages. This is the PEDS regional anesthesia website that talks about all the different types of blocks, and then you can go in there and then look up what a caudal block is, and then quickly look up like how to do it, etc. So this external resource section includes content that we do not make, but it's made by our collaborators. And then again, what we envision is that open anesthesia would be a central repository for all different types of educational resources. Another really cool resource I want to show you is the ICU one pages. These are made by Nick Mark, who is an intensivist in Seattle. For example, you look up, this is the ICU one pager on external ventricular drains. And so that's all you need to know about an EVD in one place. So these are also super high yield. And from the most basic topics like pulse oximetry and capnography to ECMO and LVADs and all that is available on the ICU one pages. So definitely please check those out. SOAP also creates simulation content, and so these also posted on the Open Anesthesia websites. And so as you can see, we have more than 50 simulation scenarios on OB topics. So for example, if you want to run a simulation on cardiac arrest and an OB patient, these resources are already here, how to set it up, how to debrief, what evaluation tools to use, etc. And again, this is content created by SOAP that we put on our website. Open Critical Care is, some of you are probably familiar with this. They have some fantastic resources on their website, like oxygen demand calculators and cognitive aids and such. These are fantastic. I highly recommend you check those out. SNAC, the Society for Neuroanesthesia and Critical Care, also has a bunch of resources on their website that we highlight here. The WFSA has an anesthesia tutorial of the week that's published every single week. That's also is posted on the Open Anesthesia website. Finally, cognitive aids. We have different types of cognitive aids on the Open Anesthesia website. The ones from Stanford manual are here. The Society for Pediatric Anesthesia PD crisis checklists are here. SNAC also has a bunch of cognitive aids that we discovered recently that we have added here. So all the different neuro anesthesia emergencies, you could access them here. And we also found recently the Canadian Thoracic Task Force has cognitive aids on bad things that can happen during thoracic cases. Again, definitely worth checking out as a fantastic resource as well. So as I mentioned earlier, the external resource page is more like a repository of other high quality educational stuff that are made by our collaborators that we post on our website. So this includes cognitive aids, this includes one pages, simulation stuff, podcasts, some other resources, etc. So that kind of is like a whirlwind tour of what open anesthesia is and what we are hoping to do here. So with that, I think I'm going to stop sharing my screen and see if anybody have any questions that I can answer.
Thank you so much for that, Dave. I see several questions on the Q&A thing, so I will start by reading them. So the first one is, what guidance is available for the scholarship of creation and invention to advise medical students, residents, fellows on how to maintain some degree of ownership of the intellectual property they create and avoid capture by faculty and institution? So your guidance may also address the concept of shop rights as well.
So, if I'm understanding the question correctly, how do we like make sure that what we create is copyright free, and we're not infringing? So whatever we post on our website on Open Anesthesia, we make sure we only use stuff that's either has a Creative Commons license, or we use or we have to ask permission from the publisher. Since Open Anesthesia is a part of the IARS, and the journal Anesthesia and Analgesia is also an IARS product, we're able to use stuff from the journal Anesthesia and Analgesia without actually specifically asking for permission. But again, other than that, all the stuff that's posted on OA is copyright, is either has a Creative Commons license or we've asked for permission. Um, I do not know if that specifically answers the question, but that's something that we obviously take seriously. We also have a medical illustrator that who creates images for us, and whatever we post on our website, we have a Creative Commons license as well. So if other people want to use it, they're welcome to use it as long as it's properly attributed.
Dave, I'm going to take a little creative license here. I think it's an anonymous attendee, but if they feel like elaborating, maybe they can. But I think what they're asking is, how does particularly a young person who's just starting out and who creates content either for SPA, open anesthesia, or something within their own society or interest area, how do they maintain some sort of ownership over that work and not have other people um, take it, I guess, or get credit for it? I don't know if that's a good question or not, but that's my interpretation of what this question is asking.
I mean, like it depends on where it gets like published, so to speak. So if this is something that's posted on the SPA website, obviously, those they have copyright rules for that. If it needs to be published, they have to ask permission, so it's less likely to get stolen, so to speak. Because otherwise, it needs to be, as long as it's properly attributed. I think you know it should be okay to use.
Okay, next, this is from Becky Wong. Um, and she says, yeah, fabulous talk. Thank you for sharing. What are some ways to convey the academic merit? This is a great question of online work publishing, for example, case guides, when one might be judged against the number of publications in traditional peer-reviewed journals with impact factors, etc.
So I think this is a problem that a lot of us have. Like, the gold standard is the PubMed ID stuff, or the number of H index, or the citations and all that stuff, which is often not available for a lot of the scholarly products that I mentioned. And a lot of the different universities are actually beginning to recognize that, as clinician educators, often we don't have like either the time or the grant funding, or to like put a traditional PubMed ID stuff, and they're beginning to recognize all these other non-traditional scholarship opportunities like this. And what I have seen work is that if you're able to show the dissemination of content, for example, if you can show that you have written an SPA case guide, and this are the number of people that have either downloaded it or viewed it, that is definitely shows widespread dissemination. And this is something that we deal with even in our institution, in the promotions committee. These are discussions we have as well. I think the critical piece is to show the dissemination of content. So, for example, we can show you that your summary on whatever was downloaded so many times, or your podcast that you recorded was listened to by so many people. As long as you can show the dissemination of content, I think that goes a long way in showing. But I think these are things they are going to get judged against the more traditional stuff. But I think more and more universities are beginning to recognize that These are also important.
And is that information that's readily available? Like, can I, if I submit something to Open Anesthesia, let's say a podcast,
Yeah,
will I then be able to go back and see how many times it was downloaded or
yeah.
how many listens there were? Okay, okay.
Absolutely, yeah. So we do have that because we use Google Analytics on our website to like see how many pod downloads, and definitely we can tell you that your podcast on such and such a topic was downloaded 70,000 times or whatever that number is, and so we're able to show. Similarly, those numbers are available also for the SPA case guides. And the SPA question of the week stuff, so we're able to show how many question downloads there are on the SPA website as well.
Yeah, great. Yeah, and I do think more institutions, at least Stanford, I think University of Colorado is the same, is starting to, go from kind of all the stuff that's published online as suspect to really looking at it much more critically now and accepting it. This is from Dr. Burkhardt, Alyssa Burkhardt. It's been fabulous to see the evolution of open anesthesia. What do you see as the gaps in this content, or what projects are hoping that someone will take up?
So I have a little bit of a bad news, so to speak. So the IRS is putting a little bit of a funding pause on open anesthesia. Like most other nonprofit organizations, there are these economic pressures right now with all the grant funding going away and stuff like that. So I do not know exactly what the future of OA is. It'll still probably be free for trainees, free for IRS members. Um, and so I can't give you exactly specific, like, what the future is going to look like in the next few years. I'm told that this pause is temporary, but we'll have to just wait and see. As far as like education gaps go, we have quite a few topics available for authoring summaries. You're welcome to reach out to me, and I'll be happy to like share the list of topics that are available. Um, a lot of the PEDS topics have been taken up, so to speak, just because of the huge representation from PEDS on open anesthesia. But we have several different like topics from like all the different subspecialties. I'll be happy to share those. But again, as I mentioned earlier, there's a little bit of a funding pause. I'm not sure what that's going to look like, but yeah, it's definitely there are opportunities to contribute.
Oh, so sorry, this is, I think, a follow-up on that very first question. And I just kind of want to, because I think this is something that definitely concerns a lot of people when publishing, particularly online. They go on to say that I had some work taken and published by others and had not received credit for my work and suspect that I'm not alone. Are there guardrails in place through either SPA or open anesthesia to try and help prevent that? Is that even possible once it's out there? It seems like it may be difficult.
I'm sorry to hear that this happened. I do not know. I'm not familiar if any guardrails like exist other than reaching out to the authors and saying that this is not right. I'm not familiar with anything else that exists. I'm sorry to hear that this happened.
Okay. And then I wanted to ask a question before I go to the final question here, in the interest of time. Very quickly, how does someone, whether they're junior or not, whether they're a medical student or a resident or a fellow, if you have like your idea for error traps was pretty, and actually the SPA one pagers, I think that was the first thing, right, that came about. These were your ideas. These were things that you and maybe a small group of people had figured out. How do you take that from the idea stage to actually getting someone to do something about it and to get it out there? Do you have any tips or suggestions on how to operationalize something that you think might make a great contribution to scholarship?
Yeah. No, I think collaborating with others is definitely the way to go. I mean, like I'm a small part of all these different projects that I've shared here. I definitely don't take credit for all of it. And we have had our failure, so to speak, and like, we got rejected by one particular journal, and then you go to the next journal, and so that has also happened. Um, but advice would be to like try to find other like-minded people like you, if you are not, in a specialty, and then work together to, and collaborate on putting something together. I mean, like the air traps example, the first journal you went to said no, no, thank you, and so then we went to pediatric anesthesia. And now what has happened since is now we have more than 20 papers, and now the original journal wants to like work on putting something together similar to what we have. And so I think my advice is finding other like-minded people like you, and collaborating, because that's the key. And it definitely is very satisfying to see the results of like all these other things that we've been involved in, and collaboration is key.
Well, I am gonna read this last one, and this is you. Can you address allegations that IARS sells the data collected from registration to open anesthesia? Even though it's free to register for access, privacy rights are very important to people. I don't know if you know the answer to this. I don't know if you do or not.
Does the IRS
Sell
sell?
sell the data collected through registration from open anesthesia.
So the only reason we added the whole like like the registration piece to open anesthesia is we wanted to see who our users are, because initially it used to be completely open access. We used to get all these stats from Google Analytics saying that we had so many downloads, and we didn't know who they were. And so we created this login process just to get an idea. So still it's like still free, it's open access. My suspicion is that eventually the IRS also wants to increase the number of members, and so there might be a push to that. They might make it that like open anesthesia stuff is free for IRS members, because at the end of the day, it often comes down to like all the different subspecialties. They want to protect their membership. For example, even at the SPA, not all the stuff that we have created is free. Some of the things are only for SPA members, because the argument I get is like, well, what is the benefit of being a member of the SPA? Like, while they have access to the SPA case guides, or they have, while the SPA one pages are free, we want to keep something that is member only. The Cardiothoracic Society, all the different other subspecialty, they all operate the same. It's all about like maintaining some value to becoming a member, and that's an argument that I hear over and over. But I pick my battles on like what I'm going to push for, and I suspect the IRS is also want to make this a member-only feature down the road. I do not know, but I do not think it's being sold, so to speak, that information. But I know the goal is to increase membership.
Great. Thank you so much. And there's one last comment from Dr. Lynn. I think that's the Carol that's on there, but she says that on our easy CV, which is now what we're required to use for our CV creation, there is areas for digital content and online publications. So I don't know if other institutions have that, but at least here we have the opportunity to list some of those kinds of works and hopefully get them reviewed in the same manner as other things. Thank you, Dave. I know you are jet lagged from having come back from Austria. Hopefully that was a fun family
Yep.
Thanksgiving vacation. And
Was.
thank you everyone for joining us on this first Monday after Thanksgiving. And I hope everyone had a great Thanksgiving, and um, see you probably, Dave, in Denver in a few
Yes.
months. Yeah.
Thank you so much for the opportunity.